is where we think about how you merge science with nutrition and the idea of trying to protect the world against climate change. Where are you on the spectrum here? How do we think about nutrition and food and the environmental footprint?
Yeah, well, let me start to say that I think it's really important to realize that, in fact, we have to end poverty, and by ending poverty, it means, in fact, that, of course, many of the low and middle income countries need to improve their economic growth. That's critical. And as part of that, I think, one of the main obstacles which has been recognized by the World Bank is, in fact, that many of the low middle income countries have a high prevalence of undernutrition. And particularly undernutrition, which started in the first 1,000 days, because actually that will influence, in fact, your brain development as well as in the longer term, your obesity and chronic diseases. So to tackle that problem, they have realized that we need to prevent what we call stunting, what happens in the first 1,000 days. And to do that well, in fact, children need to have the most optimal nutrition. And it means, in fact, animal source food like, eggs and milk. Well, at the same time, of course, we have the climate problem. Mm-hmm. And, many research papers have recognized in the past 2 years that, in fact, agriculture is actually a main contributor to the greenhouse gas emissions. Many people know about, of course, the energy sector, but not many people understand, in fact, that the agriculture is also very critical. And yes. So recently we had in January a very important paper came out by the Lancet Commission, and they showed a really great sustainable diet, which was within the planetary boundaries. And with a big focus on the prevention of obesity and chronic diseases. And of course, if the world would shift to that particular diet, we would have millions of people who would be, not dying from, in fact, these chronic diseases. But what actually was missing in that paper was looking into what it meant in the context of the whole world, like at country level. So I think at Johns Hopkins we did this research looking into 9 plant-forward diets in the context of 140 countries. And of course, the results were really remarkable.
So, Doctor, what kind of solutions have you managed to come up with? I mean, is the answer to ask certain countries to do less when it comes to agriculture production or protein-type production so that developing countries can have more than their allocation? Is it some kind of, balanced approach globally? Do we all need to work together as a globe for this?
Well, it's absolutely the case. You look at what the impact, at least the data clearly showed, what also the Lancet showed, is that in countries like North America, Canada, Latin America, Europe, we definitely have very high greenhouse gas emissions because of our agriculture production and consumption. And we should reduce that to a much more healthier diet, and automatically, of course, we would reduce, in fact, our emissions. But the situation is a bit different in the low and middle income countries. Just for those countries to actually give the options to their population to provide them with a healthy diet. That means, in fact, that they will increase their greenhouse gas emissions because the current production as well as the trade is not actually enough to provide them with the right options. And I think so that's why, in fact, we have to look at it from a global perspective because the whole food system is, of course, interdependent.
Yes.